Welcome to HRG's Revenue Cycle Review podcast. Thank you for joining us.
The mission of HRG's podcast is to educate, discuss revenue cycle topics, and interview healthcare leaders.
Together, we hope to provide our community with contemporary information and feature industry leaders on a bi-weekly basis. We're your hosts, Danae Teege
and John Gibson.
Thank you for joining us on today's HRG Revenue Cycle Review. Today, we have Robb Gardner from Henry County Health Center. Thanks so much for joining us today, Robb. Can you tell us about yourself and your organization?
Yeah, good morning, everybody. Thanks so much for having me on. It's an honor to talk with you all. My name is Robb Gardner, CEO at Henry County Health Center in Mount Pleasant, Iowa, as Danae said. And, Henry County Health Center is a critical access hospital located in southeast Iowa. We've been open since 1921, so we're about to soon experience our 100th birthday very soon. And just a little bit about Henry County Health Center. As I said, 25-bed critical access hospital. We also do have a 49-bed attached long-term care facility and provide a wide breadth of services from outpatient services, surgery, and other professional services to serve our community in the region. So happy to talk with you all about what's going on at Henry County and our response to COVID-19.
How big is the community that your hospital is in?
Yeah, so we serve Henry County is a population of 20,000. Mount Pleasant proper is right around almost 9,000. So our service area is just a little over 20,000. So we serve the Henry County region. We're a county hospital, so that is our primary service area is in that region.
And I'm sure that COVID-19 has taken a toll on the community as well as the hospital. So as all of this started coming about, how has your organization handled this? Did you put a core team together to manage this crisis, or how did that go for you guys?
Well, one of the things, Danae, is, as we all watched late February, early March, as it started to have a higher prevalence in our country, we were starting to do some early planning of, okay, the what ifs, how do we move forward if this starts to come to Iowa and to Mount Pleasant. And so it was really that second week of March when Iowa started to have its first cases of COVID-19. And once that occurred in Iowa, we then implemented our incident command team in terms of our emergency response. And so we activated that. And since that time, we actually meet daily. We were meeting daily, 7 days a week for a long time and twice a day. And then recently we backed that off to just meeting Monday through Friday and now just once a day as we've kind of began adjusting to how to live and possibly operate with COVID-19 and still provide services to the rest of the people in our community who need healthcare.
Sure. So on your incident command team, who do you have as part of that group from your organization?
Yeah, we have, on our incident command team, we have our administrators that are our chief nursing officer, our chief operating officer, our CFO. We also too have our administrator of our nursing home, because obviously with the COVID-19, the nursing home population is such a high risk population and such a critical service line for our overall service line anyway, but we wanted to make sure we're paying high attention to that. In addition to that, we have our HR director who oversees the manpower pool. We have our public information director, who's our public information officer on their emergency response, to making sure how we communicate back with the community, our associates, medical staff. We're also too have our chief of staff on our medical staff, who's just done a phenomenal job as our physician on the group, and he's highly respected. He's our ER medical director and EMS medical director, and he's highly regarded, and he's just provided a lot of insight and knowledge. He's past military, so he's been served our country for over 20 years and been deployed, so he's got experience with how to respond to a crisis, and he's just been a great leader. In addition to those other members, we have our quality infection control director. Obviously, with pandemics and COVID-19 infection control guidelines, screenings, has been critical, and she's been just a great teammate on there, along with the last person is our facilities director. Our maintenance facilities team has just modified so many things throughout our health center to allow us to better care for our patients and community. And then as we got started, we recognized in our community, as I said, we serve a region of about 20,000 or so. Majority of the primary care in our community is provided by a primary care group that's in private practice and has been so over 30 years. And we've had a tremendous collaborative relationship with them over that 30-year time frame. They're a 10 provider practice. And so we did ask their administrator to join our incident command team so that we made sure that we were all on the same page, knowing what was happening, and that we are collaborative throughout this pandemic as one healthcare medical community caring for our communities.
Sure, that sounds wonderful. And it kind of brought me to my next question for you. And that was, how have you had to collaborate with other groups in your community? And working with that group of physicians sounds wonderful. I think that's, the best thing you can do at this point in people working together. Have you had to partner with any other groups within your community?
Yeah, one of the things that has also to greatly benefit us as we've responded is we have a management agreement with Great River Health. Great River Health is a rural referral health system 25 miles to the east in West Burlington, Iowa. It's a 2-hospital system. It's Great River Medical Center and Fort Madison Community Hospital. We've had a management agreement with Great River Health for a little over 10 years, 11 years now. And, we really worked and we continue to work as wonderful partners. And we have daily calls as a system. How do we respond? And we've really collaborated from everything from implementing a COVID-19 24/7 hotline so people could call in the region if they had symptoms, and nurses would triage those individuals to be able to go forward, as well as, then going forward with how to be able to serve the region in terms of working collaboratively on how we do services such as respiratory centers, personal protective equipment, other things that we all implemented throughout this journey.
Wow, that sounds like a excellent relationship that you guys have in efforts to make sure that everyone is well taken care of, especially during this time. But yeah, what a great amount of time to have a partnership with that organization. 10 years is a long time, and I'm sure you guys have dealt with a lot over the years. Maybe not as much as COVID-19, but so I'm going to ask John if he has any questions at this point.
What I would like to know, and I think hopefully some of our listeners would like to know, has there been enough time, or have you been able to identify any declining of revenue yet? I mean, I know elective procedures across the board seem to be down, but between you or your physician groups, have you been able to identify some of the kind of negative financial impacts since COVID has began?
Yeah, John, one of the things early on, based on the CDC guidelines, CMS guidelines in the middle of March, working with our medical community, we did stop elective surgeries on March 18th. The Governor Reynolds, the governor of Iowa, further substantiated that just a week later, and she put in a proclamation that non-essential and elective surgeries that utilize PPE would have to stop until further notice. And then also too, CDC, CMS guidelines came out and said, really, if it's a non-urgent, non-high acuity visit, those visits should be suspended. And so, and try to utilize virtual visits as much as possible. So again, we all of us in the medical community deployed as much virtual visits as we could. But, when you suddenly, just like any other, majority of us as critical access hospitals, our revenues are approximately 80%, total 80 to 83% outpatient. Our net revenues per year sit right around 37, 38 million, 37 based on the year, 38 million based on the year net revenue. And if 80% of that to 85% of that is suddenly really not occurring, that's a significant financial impact. And we also too have seen throughout that the response is everyone's doing a wonderful job in our community of following the social mitigation responsibilities that our public health officials in Iowa, along with the governor, have put into place. We've also seen a significant decline in our ER visits. We used to average about 25 visits a day. We now see low teens. And so we initially saw we were real busy on ER and inpatient as the ramp up with COVID in our area occurred. But then since we've kind of seen a declining number of cases, which is a good thing in our county, all those other visits, all those other needs from a medical care has also slowed down a lot. But so we, from a process to track our revenues, we started early on. Within a week, our CFO, Dave Muse, who's just a very visionary financial leader, he started to develop a process where he would track weekly revenue, weekly AR receipts, and then weekly AP, just to kind of get a sense of how much revenue is coming in, how much cash is coming in, how much cash is going out. He actually worked with the Iowa Hospital Association to set up a tracking tool so we could get a sense in the entire state what the impact was. And so we watch that weekly, and it's become very difficult to watch. As of last week, actually through last week and got the numbers early this week, we're down 54% in our weekly revenue. We already had a very challenging fiscal year, despite being a MAP award winner and being a top 100 hospital by Advantage in 2016 and 19. We recently financially have had some really difficult years because in Iowa, they implemented managed care Medicaid back a few years ago, and our Medicaid mix through the end of last year, we were in the low 20s in terms of a Medicaid payer mix. And so when you lose your cost-based payment because of managed care Medicaid, and your payer mix goes up, we've had to make some difficult decisions. So it's been a year of difficult decisions. We announced back in November we were going to close our inpatient labor and delivery unit. And so that's on June 1st. So that's, in the midst of all the COVID-19, we're also making a transition of a service that we've provided since 1921, coming here in about 30 days. And also we provided the county EMS services since the early 80s. And it's been even that's been recognized as the national EMS service in the country. That was in the late 90s.
Oh, wow.
And because those two services are cost-based reimbursed, because that draws down our critical access hospital payment, and we're trying to make some difficult transitions. So it's been a year of transitions, difficult choices because of the finances. So the COVID-19 financial implications have further implicated those things.
It sounds very challenging. I know that people that have been in cities and not in the rural communities don't all the time understand the difficulties in the smaller communities and the challenges of critical access hospitals. So, but you guys are still doing well and supporting your community, and I absolutely appreciate that. You know my background, and I've told you my stories about critical access hospitals, and so I appreciate you guys and everything that you do. As far as the elective procedures and what you guys are going to be able to do you have any idea when you're going to be able to start? Because I think Iowa, and maybe we should start there. Iowa did their stay-at-home order a little bit differently than some of the other states, if I remember correctly. Would you tell us about that?
Yeah, I really want to I'll be happy to. And, Governor Reynolds, I want to really support her. Her and her team have done, I think, a great job for our state. And, they really have looked at it on a regional basis and a local level and done everything from not per se a shelter at home approach as some states have done, but also has implemented very similar orders. If you put them side by side, the orders that she's put in place for restaurants, parks, different businesses, gyms, number of people who can be in one setting at a time are very similar. The social mitigation strategies that her and her team have put in are very similar to a shelter at home. And so just as of everybody else throughout our country is, the state of Iowa is trying to figure out how to open up just a little bit while making sure to ensure the safety of Iowans. And so just recently, as of last Friday and this week, she's continuing because a lot of her orders were through today. And so May 1st is when things kind of start to change a little bit. Because really, the instances of COVID-19 in the state of Iowa is really a much higher prevalence in about 22 counties. And Henry County happens to be in one of those counties. And so the areas in Iowa that have been impacted are those communities, and you probably have seen that on the news, those communities that have been impacted by a meat packing plant that has had an outbreak. And then just the larger cities in our state, Des Moines, Cedar Rapids, Waterloo, Iowa City, Quad Cities, Sioux City. So obviously with the higher density of population that has been impacted, and we're just 50 miles from Iowa City.
Sure.
So yeah, that's, in terms of the response, Governor Reynolds did put in a new proclamation last Friday, suddenly which allowed the elective surgeries and outpatient surgeries to resume as long as you met a specific number of criteria. You had to make sure that you COVID-19 tested those people who are going to have surgery. You had to make sure you had enough beds available for a surge. You have to make sure that you have enough personal protective equipment. You have a reliable supply chain. You can't rely on the state stockpiles. You have to make sure you have enough staffing. You have to have a surge capacity. So if you have an outbreak in your community, what will you do? And basically, you have to set up all these different compliance and monitoring along with the criteria to make sure if you do have an outbreak, you shut the surgeries off again, basically. And so you can respond appropriately and care for your community. Because as we know, it's how do we move forward and continue to operate. And we've implemented a number of measures. Everybody wears masks in our hospital and have so for almost an entire month. Everybody gets their screening questions by the CDC, get their temperature taken, and that's all our staff, but also to medical staff, patients, and visitors. Everybody gets that, and so we really, safety of our staff, medical staff, and our patients and visitors is our top priority. And so hopefully by keeping those same mitigation strategies in place, we can slowly restart within the next week some elective surgeries, and we'll do a phased in approach where we're not full steam ahead, but obviously start on, I'd say it's going to be somewhere around 40% to 50% at most. To make sure that we can do that, we have appropriate levels of personal protective equipment. Our materials management director, along with all the leaders, have worked extremely hard to get us to an appropriate supply level through our supply chain. And also to our environmental services director, she's done a fabulous job to make sure we have the necessary cleaning supplies, because we can do all we want from equipment, but if we don't have the necessary cleaning supplies, it's not going to really matter. So it's been an incredible team effort, great collaboration amongst our medical staff and our leaders and our associates to really be fluid in all these changes. But we hope over the next week or so, maybe into the second week of May, restart providing some of these outpatient services to our community and really start to, as many of us said in the healthcare community, coexist in providing necessary healthcare, because everybody else still has their health problems that need to be addressed. But how do we do that while COVID-19 is still existing and keep everybody safe?
Yeah, no, I think I've seen firsthand an experience I had yesterday, and this is just kind of relating to the decline that you've seen in ER visits. And I was allergic to something yesterday, but I was like, I might just stay home instead of go to the ER, because hopefully this will pass versus risking getting COVID at the ER. So I think that your governor has done a tremendous job in those specifications, and it sounds like your team has done wonderful. I know that a lot of times environmental services and maintenance and in those parts of the organization are left out of the glory of healthcare. But really, yeah, you're right, without having that equipment cleaned, it's not of any use to anyone. So that's great. That sounds awesome.
And then on that today too, I would just add, for example, our facilities team has just responded. We added almost an additional 8 negative pressure rooms in our organization. We have 4 temporary ones on our med surge that we were able to put together, and then we added right at the start of this, we added and got them done within a very short time frame 2 permanent negative pressure rooms in our ER.
Oh wow.
And that becomes that's the team working long hours to make that a possibility, but it's also too, and I think that's, I go back to all our other, we're a 4-star hospital in terms of great patient satisfaction, great quality. The other tremendous recognition we've been blessed with over the years, but all the great rev cycle recognition, but we still have challenging finances. And so I think it's that when I've spoken to our senators at the federal level and Congress, individuals, leaders, if it's an example how difficult it is to make it go in rural healthcare with, even with some of our very blessed recognition, we're still having difficult finances. And I think
Sure.
it's where, what does this do, COVID-19, to rural healthcare? And I don't think
Right.
anyone knows what the new
Right.
normal will be.
Yeah, that's a great point. And I think we don't know what the new normal will be yet, but we do know enough to know that it's going to be very different and the impact is untold. But, our world is going to change and healthcare is going to be the first to be impacted, and the peripheral around it. And I think you made a really lot of insightful points, Rob. I mean, you were able to illustrate some of your pragmatic approach around safety for your own patients, but also your staff, which I hadn't honestly considered, without having to consider your perspective. But secondary to that, the unsung heroes throughout this process. And so there was there's a lot to really consider there. And you're right, we don't know the impact on rural health for sure, but you have your own specific challenges in that sector, also in LTAC, correct?
Yeah, we have a long-term care facility again, so that's, for many years,
Yes, yeah.
we were a critical access hospital, and we're one of the larger ones in the state of Iowa. We have a little over 300 employees, and we're providing a lot of services that are non-cost-based reimbursed. And we were able to do that because we had the volume. We do anywhere around 150 to 180 surgeries a month, and so our surgery is a very important service line to us. And so when all those changes occur and you're still providing a lot of non-allowable services that are not cost-based reimbursed, those are big implications that we've got to make some difficult choices going forward.
Yeah, a lot of risk, huh? Interesting.
Because this
The one
all
thing,
seems, oh, go ahead.
I just wanted to say tonight too, I just want to, point out that through this, we just had some tremendous associates and medical staff who are just so fully committed. They're here every day. We've got staff in our nursing home that are working with elders in a high acuity place that, are wearing face shields, face masks, all the PPE to keep them safe and the elders safe. And, our environmental services, maintenance, our medical staff, everyone continues to show up and so committed to care for our community. And that's what we always, we've got a statement here where we say always essential. And that's what I think is so cool about rural healthcare is everybody knows they're in it to care for their community, their neighbors, their loved ones, the people they see out in the store and the street. And that occurs in the urban markets too. I'm not saying it doesn't, but it's just more real when you see them on a more regular basis.
Yes. Yep.
And,
Absolutely.
it's just something that I'm so proud of everybody's commitment in uncertain times, so I just want to make sure to recognize our tremendous group of people.
Yeah, I think it is much different than the larger cities, only because, like you said, you see these people often. You see them at the grocery store, the library, picking up your kids from school, and so it's kind of a different, it's a different world. But I appreciate it for sure. What's giving you and your organization hope through all of this? What kind of, I mean, outside of your team has done a wonderful job, everyone's coming together. What else do you guys see as the light at the end of the tunnel?
I think hope is always, eternal. I think, I think you have to have faith and trust in the people you've surrounded yourself with. And I think I'm blessed to have a highly committed medical staff who is going to make sure that, how do we continue to care for the community? We also, too, have a board of trustees that is committed to be dynamic and changing however we need to make sure we're here for another 100 years. And then I would say, it's I am thankful and very much so for our partnership with our regional partners over at Great River Health. When you have a regional healthcare that's committed to caring for your region locally and understanding it's about the greater good. It's about how do we serve all of us versus just one of us. And it doesn't mean that things won't have to change in certain areas. But I think all our personal lives are changing, all our professional lives are changing, and I think with this change, whatever we come out, if it's in, I think we're going to see changes 3 months, 6 months, 12 months, 18 months, 2 years, 5 years. Uh, that's how we evolve. And my hope, and I just know that we have, because you look at this organization. I remember, my background that I didn't talk about. I'm a clinician. I'm a physical therapist and an athletic trainer. I provided healthcare, provided clinical care for. I was blessed for 13 years up until this job. I was a director of rehab, and but in 2001, I was the rehab director here at Henry County Health Center. And I remember 9/11. I remember that day, and I remember how we changed our lives and how our work lives changed. And so, and that was a tragic day, and we'll go down, always remember it as a tragedy. And I think it's the same thing as how do we evolve, and we found hope, we found guidance, and we all came together. And I think that's the thing that we will continue to do, not only as Henry County residents, but Iowans and as Americans. We'll continue forward. And so, but I think it's, you got to surround yourself with positive people who can help you do that. Because I'm the first one to tell you, there's been a lot of difficult days.
Yeah.
And I'm blessed with people who I get to meet suddenly and help me through those things, along with people who have been people throughout my life that I've been able to go out to and talk to help us keep moving forward.
Our LinkedIn messages helped me tremendously, just connecting, and I appreciate you, Rob. Thank you. John, what
I
other
love that.
questions
Hope
do
is
you?
eternal.
Yes, I do love that too. Hope is eternal. Exactly. Exactly.
I know. It's great. No, honestly, no question.
I just always curious on how we can continue to help you guys or help others. And if you have any other insight that we can learn from, that's always healthy.
On the good days and the bad days, I think you guys are doing just a really terrific job. Do you have anything that you would want to share with your peers from other, as a CEO, as a physical therapist, as a man in a community, anything else you'd like to share?
One of those things is just, continue to work and rely on others. It's, don't feel like you got to do this all by yourself. And you got, surround yourself with great people, support them, guide them, and then work alongside them. And I think if we do that and you work with people throughout the business community, along with experts in the field, everybody's knowing the challenges that will exist and do exist. And I think this will bring us all together and make sure that there's access to healthcare and as in every community that's possible. So I'm humbled that you asked me to talk with you, and hopefully it gave some insight. And just again, thanks for your time.
I think it was terrific. I think there's a lot of things that people don't always think about in this kind of situation. And really, honestly, what you had said about I worked with a lady named Rosalie. She was the purchasing manager. And so while you were talking about them getting the supplies, I was thinking of her. And, these are all very important jobs going through something like this. And so I'm grateful that you decided to hop on with us.
Happy to. So, well, I wish you guys all the best.
Thank you, Rob, for sharing your insights and your perspective with us today. Please join us for our next episode of the Revenue Cycle Review. I'm John Gibson.
And Danae TG, thanks so much for joining us.